Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Blair, thank you so much for joining me. Could you start by telling us a little bit about what the Youth Empowered Society is?
Yeah, sure. Thank you so much for having me. My name is Blair. I'm Executive Director of the Youth Empowered Society, or the Drop-In Center. We're a drop-in center for young people who are experiencing homelessness between the ages of 14 to 25. We were actually started by young people themselves who saw the need for a safe space to exist in the city to get access to resources and support. And so we provide basic level services, food, clothing, place to charge your phone, do some laundry, take a shower, take a nap, connect with case managers, get connected to other services. We do workforce development work, helping folks get access to job training programs and jobs and pay them for job training with their participation in job training. We have rapid rehousing, so connecting people to housing and then providing rental assistance for up to 2 years. We do intensive case management to ensure that they can sustain that housing. And then a lot of youth leadership work to ensure that young people are leading the movement to end youth homelessness in the city. So that's kind of generally the kind of overarching work that we do.
And how many young people do you support each year?
Yeah, so we see over 300 youth a year that come through our space. As many as anywhere between 20 and 50 a day will come through to get access to some level of service that might look like just dropping by the front door and picking up some bus tokens, or coming in and getting some mental health counseling or harm reduction support, or having some conversations with community partners.
So how has the COVID pandemic affected your critically important work? What happened when this all started?
Yeah, so when it all started, it feels like such a blur. It feels like so long ago now. To start, our space is really small. So we actually are operating in a row house on 23rd and Charles, and it's a space that is not good for social distancing. So we're bumping into each other constantly. The hallways are super narrow. We're already on top of each other. So when COVID hit, we really had to kind of rethink how we were showing up as a drop-in center and how we were supporting our folks. While we were also seeing folks starting to lose income, right? So folks were losing jobs and became essential workers, many folks, and weren't able to access the kind of PPE and stuff that guarantee their safety. So really thinking about what workforce development and work support looks like for our young people, thinking about safe spaces and what other safe spaces exist in the city. How do we show up as a continued safe space when there are so few physical locations that folks can access right now? Thinking about safe housing and shelter capacity. So the city was, also kind of blindsided in lots of ways around COVID, and shelter capacity and shelter ability to support folks reduced pretty drastically, and they've rebounded from that. But our young people already didn't feel safe in shelters. And so we had to really think about safe ways to get folks into temporary housing that would be socially distant and deeply supportive. And so we were thinking through that. So it kind of affected folks, and then mental health, right? And trauma. It's a huge collective trauma that we're all currently experiencing right now. And when you add that on top of the systemic oppression, racism, transphobia, homophobia that folks might experience, it really sparks that resilience. You have to figure out some way to maintain. It also was really deeply harmful. And so folks are managing, and some folks are struggling.
Yeah.
And it's just a combination of all that.
So you had to take a whole bunch of different challenges, from the actual direct physical susceptibility to COVID and the risk people would be getting sick, to the fact that this really disrupted a lot of the relationships that people were relying on.
Yep.
So what did you do?
Yeah. So one of the first things that we started to think about, and it came up in some conversations with our team members, was just about connectivity. And thinking about the fact that many of us, staff and some of our young people too, right, are in homes and have access to maybe Wi-Fi or a computer or a phone that's pretty reliable. But for most of our folks, that wasn't true. And we would only really see them when they came through the drop-in center. And so we're losing touch with so many of our folks that we were like, we have to get folks phones. We have to get folks access to some level of technology just to stay in touch with us. And so we started to do fundraising around getting phones to folks and paying for service plans when the phones are in their name. So that way they could call us and get connected to services, that they could participate in virtual workforce development sessions. We started to do virtual youth leadership engagement sessions, virtual support groups, just talking about stress and trauma and how folks are coping right now. And by getting, a couple of young people phones, their extended community then also got access to the technology and were able to connect to us as well. And so that's been a huge piece of what we've been doing is just getting that out to folks, getting folks PPE, so masks, gloves, hand sanitizer, all that kind of stuff to make sure folks are doing well and being safe. We also started working pretty closely with a community partner, the Charm City Care Connection, and they were doing some really incredible work, seeing a huge need around housing and connecting some of their folks who use substances into safe housing in hotels. And so we started partnering with them to also expand that work and get some more young people into shelter, essentially, in hotel rooms. And that's been a really important partnership that we have been doing and continuing to do. We have a safe place to be able to get folks if they're experiencing street homelessness and have nowhere else to go. And then offering both in-person supports on Fridays at Yes. We have a farmer's market Friday. We're giving out lots of different things. Again, clothing access, folks picking up mail, figuring out ways to continue to get money to people. And so trying to expand the workforce work we're doing, the youth leadership work that we're doing, just to make sure that folks are getting some level of income right now and getting folks access to that to sustain.
How do young people in this really difficult circumstance where they're really struggling to survive, they're putting some of the basic, building blocks of their future together, how do they see the threat of the pandemic? Is it just something that's disrupted what they have been working on? Is it something that they feel more of an existential threat that they could get sick themselves? We read a lot about how young people have all these different ideas. How do the young people you work with think?
Yeah, I think it's a really broad array, depending on who you're talking to. Definitely folks are deeply concerned about getting sick and fearful of what that means for themselves, for their kids, for their communities, for going back to work or being at work, and, recognizing that being an essential worker also means that there's some level of risk that you're taking around your health. And there are also some young people that, we all make decisions on the ways that we show up in the pandemic and in our social circles and in our friend networks. And we've been doing this now for a minute. And so, making those decisions around, I think I really need human connection right now. And so I'm going to hang out with these folks and I'm just going to do my best. And that's just what it's going to be, because that power of human connection is incredibly important. And if folks don't have access to that, then they also mental health is not great.
Yeah.
Right. And so I think folks exist on an entire spectrum.
That's a great point. How are your staff doing?
That's a great question. I think collectively tired and burnt out, to be very honest. Shifting into a largely virtual model, supporting our folks in a very different kind of way, almost more urgency driven than it once was, right? I think sometimes we would think of ourselves as an emergency room, kind of dealing with a lot of the crisis and trauma that existing systems that aren't able to work through. Hospitals, the police office, just all kinds of systems aren't able to deal with. And we really rely on the relationships we have with folks to that central space for folks to get to. And so yeah, staff we're tired and stressed. And also I think, really trying hard to figure out how we take better care of ourselves in this time that also it's a time that the world is slowing down in some ways. And so it's really important for us to use that to rethink some of the work that we're doing. And also it's a time that has clearly shown the inequities that exist, that Black folks and brown folks continue to be targeted and harassed in every single possible way, including in this pandemic, right? Including health risk that is directly related to historical racism. And so, it's a lot.
So I want to ask you about that. So it's become, very clear that African American, Latino communities have high rates of COVID, high rates of death. And then on top of that, you have the protests against police violence, the reawakening of understanding about the severity of racism in this country, or at least, more people paying attention. How does that interact with just the frantic pace you have been at just to support the young people that you work with? How is that manifesting itself? Is it giving people energy because of the potential? Is it, sapping people's strength because of the frustration at the injustice that we can see? How does that play out?
Yeah. Again, I think that's kind of like a both. The answer is both. It usually is a both and. Yeah, I think it's definitely inspiring folks like our team organized to be part of various protests, right? We have a huge banner in the back of our space that says fund housing, not policing. And that was made by young people during the uprising with Freddie Gray in 2015. And so, it's just a really we're here again, right?
Did you take that banner back out on the streets?
No, we actually didn't because it's not the most March ready banner, but I think I'm feeling really empowered, and I know other folks will be feeling really empowered, but the asks are a little bit different and more pointed and targeted, and really thinking about how we can really vision a world that actually is meant for us, where, body cameras aren't good enough. We really need to rethink what community policing looks like, what community health looks like, what our investment is in schools and people, right? And so I think that is incredibly inspiring. And it's also deeply draining to be here again in the midst of a pandemic. And so I think I'm finding so much that, self-care is a thing that we always talk about. And we it's stuff that we say and don't really personalize and operationalize. And I think right now, part of our exhaustion, figuring out how to operationalize self-care practices more. And it's something we're always challenged with.
Yeah.
And we're continuing to figure out.
That's, I'm sure, an enormous task given so many things coming at you. How have the young people experienced the protests against racism and the sort of greater awareness? Because I imagine they have been experiencing quite a lot of the consequences. Is it the same for them, a combination of exhaustion and inspiration? How do you think about that?
Yeah, I think it is. And I think we've seen a lot of our folks to be a part of a movement. That is a protective factor against so many things in our lives, right? You're connected to people, you're a part of something, you're trying to see change happen, you're very much in it. And so a lot of our folks, our young people, right, have been really active and engaged, I think, in a lot of the movement work that's been happening, while also trying to survive every single. So yeah, I think depending on who you're talking to, some folks are very empowered and very motivated and very in it and excited about the world to come. And other folks are I just need to focus on where I'm going to get some money and where I'm going to be right now. And that's kind of where my focus is. And yeah, and that's all.
Well, it sounds like you're taking steps towards a youth empowered society.
That is our goal. Yes, 100%. Yeah, feeling really honored to be part of this organization and working alongside these incredible young people that challenge and support and push every single day.
Right. Well, Blair, as you know, I've been to visit you a bunch of times and I met the incredible young people you work with, and I have such deep respect for the work that you and everyone at YES does. I wonder if people are listening and they want to support your work, whether there's anything that they can do.
Yeah. Thank you so much. Yeah. So we have a new website, same address. YES, Drop-In Center, YES, dropincenter.org. And so there's lots of information there on the website. Donations are really helpful right now, especially thinking about some of the COVID response that we're doing around hotel stays, around cell phones, around making sure that folks have access to virtual spaces and income. And so just giving us a donation would mean a lot. So that's YESDropInCenter.org, following us there. And then really just, honoring collective and community work, looking into other organizations that are doing very similar work and very on the grounds work. Baltimore Safe Haven, incredible transport organization nearby us. Go hit them up. Charm City Care Connection, incredible community partner that's doing this hotel work with us as well. Hit them up. Yeah, there's a lot of folks that are really activated right now. So definitely connect and volunteer. Also, we're looking for volunteers occasionally too.
Great.
And
well, so you said it's YESDropInCenter.org.
YESDropInCenter.org.
Very good. Okay, yes. Well, fantastic. Thank you. I know how busy you are. Thank you so much for spending some time with us today.
Yeah, thanks, Josh. Yeah, I appreciate it. Take care.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.